And we also see older people, and I'm talking, let's say 80 or 90 years, also with cataract. So, and like you said, the older you get, the more complex, you know, it becomes to treat cataract.
Yeah.
So for this person, let's say, who is 80 years old or 90 years old, but wants to treat, probably has cataract and wants to treat it. So what usually happens? Like, what's the procedure for this person, given that it's a complicated, you know, surgery to do?
What's the procedure, you mean?
Yes. Yeah.
Okay. We have to first evaluate him for all the other things, like whether he has any associated complications also with the cataract. Like we need to evaluate for his blood pressure, blood sugars, and other conditions that might be exacerbating the post-op complications. Okay. Then we need to examine his eye fully for the pressure, for the ultrasonography, and the IL-PAR calculations. All these things need to be done so that in the post-operative thing we don't have any surprise. So that is the way that we go.
Okay. What might happen after the surgery? Because like you said, post-surgery surprise. What might happen? What are some of the complications that might arise after the surgery?
Mostly it's a very, very safe surgery. It's, you can say that it's rare to get any complications in any cataract surgery that way. It's only in the complicated cases, like there is sometimes a pseudo exfoliation in which the zonules of the lens are already weak. Before we touch the patient, it's already weak. So intraoperative, there are chances of uveitis and the subluxation of this zonular weakness, and all those things can happen. But this is quite rare that way. And sometimes you have like if there's a hard cataract, in post-operatively you can have a bit of corneal edema that way. And infection, you can say it's a 0.1% or very, very less chances of infection, but still there is a chances of endophthalmitis after surgery. So it's very essential for the patient to take a very good post-operative care. He should maintain a good hygiene and follow the prescription accurately so as to avoid all those things.
And the complications.
That
and how long does it take for the eye to completely heal after surgery?
It can take its 1 week or 2 weeks that way.
All right. Does it have, you know, the age in terms of, let's say, children heal faster than the adults, or is just 1 week for both the juvenile cataract and, of course, in older generation?
Children do heal faster that way.
Okay.
They do heal faster, but they do have a tendency of more amount of inflammation after surgery. So we need to treat aggressively with steroids in those children, so that way.
All right.